Antisocial personality disorder is dangerous. Those affected hide it very well. They may act like you or me, or the person next in line in welcome, disguising their true nature. In fact, they can often be very charming, blending in and fooling the masses. The characteristics of antisocial personality disorder are those found in serial killers. Antisocial personality disorder is not much distinguished from psychopathy and sociopathy. The key diagnostic factor is how the person relates to others. They do have a clear understanding of how people think, but don't understand or don't care how people feel, and thus act in ways that harm others without feeling remorse. To remember the defining symptoms of antisocial personality disorder, think 4 R's and 1 E, which stands for 5 key qualities that people with the disorder repeatedly lack. We also made a helpful hand-finger model to help you remember, so please follow along. The thumb stands for empathy, so people with the disorder are contemptuous or ignorant of others' feelings. The pointer finger stands for the lack of restraint, so impulsivity, aggression, and irritability that goes unchecked and that manifests itself in behaviors such as gambling and fighting.
Ow! Stop! I don't You're stubborn!
The middle finger represents the lack of respect, so the failure to conform to social norms, law infringements, clowning, lying, being arrogant, etc. Ring finger is the lack of responsibility, so antisocial personality disorder is often accompanied by negligence towards work and financial duties. And lastly, the pinky finger stands for the lack of remorse.
Symptoms usually begin in childhood or as a teen and peak in late teens and early 20s. It gets less intense with age, with symptoms declining by age 40. There is evidence that patients develop more control over their impulsivity over time. Precise causes of this disorder are unknown, but antisocial behavior is thought to have its roots in childhood. Certain factors appear to heighten risk of development, including environmental factors such as abuse or chaotic and unstable family life during childhood, genetic factors such as a family history of personality disorders, mental illnesses, or substance abuse, and finally, biological factors such as premature deaths are also a potential risk factor. You need to be over 18 to be diagnosed with antisocial personality disorder. Diagnosis of childhood conduct disorder, which is very similar to antisocial personality disorder, is regarded as a precursor. Heritability of conduct disorder is thought to be about 50%. Patients with antisocial personality disorder have less active frontal lobes, which control impulses and planning. They also have a hyperactive dopamine reward system, making them even more impulsive. Studies show that patients are also less reactive to emotional stimuli, making them fearless. Prevalence of antisocial personality disorder in the general population is about 0.2% for women and 1% for men, with a higher percentage among psychiatric outpatients. The prevalence is about 70% or more in prison wards and substance abuse clinics. Antisocial personality disorder is both difficult to diagnose and treat because most of the affected deny their problem and rarely seek treatment on their own. There are no medications that they could take to fix this disorder. No research has proven any medication is effective. Some take medications that help accompanying disorders like depression, ADHD, and substance abuse. Your options for treatment are sessions of cognitive behavioral therapy or psychotherapy in the long term, where you talk about your disorder in structured ways.